My name is Ron Guillolt. I'm 53 years old. I live in Denver, Colorado. I have a wife and 2 kids. We have a 12-year-old daughter and a 15-year-old son. And I want to share a little bit of my personal journey in trying to prevent a death from heart disease. And the reason I'm doing this now is there's a new software technology called CLEERLY, recently FDA approved. It's an AI machine learning based technology to help diagnose coronary artery disease. And I'm actually going to have this test done in a couple of days. My mother, when she was 47 years old, started having chest pain, went to see a cardiologist, and a few days later had a quintuple bypass surgery. My brother, at age 40, had a heart attack and received a stent. He was rushed to the cardiac cath lab and received a stent. So obviously there's some family history concern. When my mother had that quintuple bypass, I was 26 years old, a 30-mile-a-week runner, and about 10 or 15 pounds heavier than I am now. I went and got my cholesterol tested. My cholesterol was 266. I thought I was in really good shape. I thought I ate reasonably healthy, and I exercised. I went on a hardcore vegan diet, completely changed my diet. I did not take any statins. I did not want to do any medication at that point in time. And by going vegan, within 6 months, my cholesterol was 166. And 6 months later, my cholesterol was actually 110, and still without any medication. A couple years later, when I was turning 30, an endocrinologist and a cardiology friend recommended I get a calcium score. So I did, and luckily, my calcium score was 0. I did it again at my 40th birthday, and again for my 50th birthday, and I still have a 0 score. So that's good news. However, what calcium scores don't do is tell you if you have soft plaque, thrombus plaque, fatty plaque. I'm still at risk of a heart attack. However, this new test that I'm going to have is going to tell me if I have any non-calcified plaque. And I'll admit, I'm a little nervous. I think I'm doing everything right. I feel good, I exercise, but this may come back and say I have a significant plaque somewhere, and next thing you know, I'm gonna go have a heart cath and potentially a stent, or worst case scenario, needing a bypass surgery. We are going to an imaging center on Broadway called Simon Med. I'm excited actually, because if everything's clean, then I know how I'm eating and exercising is working for me. I'm also a little nervous because if I have some plaque and it's significant, it could be life-changing. The coronary CT angiogram is one of the best non-invasive tests to diagnose coronary artery disease. And for the patient, we will get 3 to 1 millisieverts of radiation, depending on the CTA technology. The test was super easy. It was actually quite comfortable. Some patients have to take beta blockers. I did not, and I was actually in the room for less than 18 minutes. So I'm the second patient in Colorado to have this done, and for my internist, tomorrow I will be the first patient he's had who received a CLEERLY CTA. And I'm gonna find out whether I'm coronary disease free or what my status is. Yeah, nice to meet you.
Tell us why you felt strongly about doing this study.
The next afternoon I met with Dr. Colson, my internist, and one of his colleagues, and we did a Zoom call with the CLEERLY team.
It's like a gender reveal party, except it's an arterial reveal party.
The CLEERLY chief medical officer and their clinical team joined to go over the results of the technology in the study. What percentage that RCA or percentage that LADs blocked? At first I didn't quite understand what they were saying, and then once they explained in more detail, I was hugely relieved. Oh, 9%.
So almost nothing, you know what I mean?
I'm feeling a little better. I was about to be,
Yeah,
oh my God.
Yeah.
I thought of myself being in the cath lab on Monday for a stent in the RCA.
I think you can make a tea time for a Monday morning.
I'm not surprised. I think it would be folly to think that he wouldn't have any plaque whatsoever. I think given his family history and all that he's done from a lifestyle perspective to try to limit plaque, I think he's doing a great job.
I'm ready to dance. I am ecstatic. I mean, of course I wanted my plaque burden to be 000. But at 53 with my family history, I was very worried I was gonna have much more plaque than I do. So I'm greatly relieved.